Good morning and welcome back to your Pacific Morning Show. On today's show, we have a very, very awesome and exciting guest. Her name is Dr. Melbourne Mauiliu-Wallis. She is a GP and doctoral candidate. She has done some amazing work in our Pacific community, and she was born and raised in Samoa, an ex-student of Samoa College, and is from the villages of Vaivaseuta, and she's a proud Savaian girl. Well, now woman. Sorry.
Yes, thank you.
I'm so sorry.
Really important to clarify that. Thanks.
You know how we just call ourselves like Savai'i girls?
Yeah.
My family's from Savai'i as well. But welcome to the show. Thank you so much for coming on. We appreciate your time.
Thank you.
Being here. How have you been this morning?
Very good, Hana. Quite nervous. Really excited. But being a Savai'i girl or Te Motu, this is very new for me. But I'll do my best.
Awesome. How has your week been?
Really good so far. Week is filled with seeing a lot of really, really fun Pacific patients. And then on top of that, trying to juggle a bit of research and then finding time to, remind myself that I do have a family and a husband who needs me at home. So, yeah.
Got to remember those priorities.
That's right, yeah.
So you're on your second year of your doctorate.
Yes.
And you're looking into the barriers that Pasifika women face when they want to pursue a career in surgery or into becoming a doctor. How has that been for you?
In terms of the research, so the research is going really well. I'm presenting one of the abstracts for my research in the upcoming PMA conference. And part of that is to continue the recruitment. If we'd like to take a step back into why I wanted to do this research in the first place, really it stemmed from some of the things we'll be talking about later, which is the lack of representation or seeing Pasifika within health. There's a lot of us in health, but there are not many doctors who are in health, and even fewer Pacific females who are surgeons. Now, in a medical career, you spend about 6 years in medical training, and then you spend another 5 to 6 years in specialty training, but in between that is another 2 to 5 years of trying to decide what you want to do or get onto a training program. So it's a good 20 years of a pathway from beginning as a medical student to finally becoming a consultant. One of the things I realized when I was sitting in one of the handovers in surgery was I was looking around and there were not enough Pasifika faces, and in addition to that, not enough Pasifika female faces. I only saw one Tongan registrar there, and that inspired me. I initially wanted to be a surgeon, and then that inspired my research. I was asking all these questions and thinking, why aren't there many of us Pasifika women here? And so that's all it takes for you to do any piece of research. So now I'm looking at all the Pacific female doctors in New Zealand within the New Zealand context, having talanoa sessions with them, and inquire after what influenced them in their career pathways. Because when I looked at it, stop me if I'm going on for too long, we Pasifika people, we're 8% of the New Zealand population. Only 2% of that 8% are doctors. So there's only about 300 plus or minus of us who are Pasifika doctors. Right now, more males than females. Within those 300 or so Pasifika doctors, only 4 are consultant or specialist female surgeons. That's pretty...
Only 4?
Only 4. And so that's not a good representation, really, of, Pacific people are talking about how they like to see a Pasifika face.
Yes.
It doesn't really represent or mirror the society that we live in. And so it's good for me to look at barriers and then how we can modify some of them so that in the future, say your children, they'll be able to go to any doctor from primary care to specialist care, and they'll come across a Pacific person. So that's the whole goal of this research.
Wow, that's awesome. And sorry, I'm just being cheeky here. What were some of the barriers that you've identified in your research?
Absolutely. Some of the barriers that Pacific, in some of the talanoa sessions that I have done, are really... they're similar to what other female medical students or female doctors are reporting across the world. In terms of the surgery specific, a lot of our female doctors, they come out of medical school and they actually want to be surgeons because it's really good in terms of the practical skills, and they love the immediate effect of fixing someone's health issues and then they're done. It's not a continual sort of pathway. However, what they're finding very challenging is that in these careers, the hours don't suit them. They're very, very long hours. As a junior doctor, we were doing 16-hour shifts back to back on most days. Night shifts, the registrars have it longer and worse than we do as junior doctors. So those aren't conducive to them having a family or an IEMA.
Yes, absolutely.
Yeah, because that's something that's really, really important as a Pasifika person. And then a lot of the women, they want to be mothers. But again, they're having to push back timing for having children because the training takes so long. And then by then, it's not as easy for you to try and conceive. And it's very much sort of, you've got to remember that universities and health systems, they are set up by non-Pasifika culture. It is a Palangi world.
Exactly.
According to Palangi standards. And so you have to sort of be a certain person to be able to fit into that sort of culture. So that's really, really hard. So those are some of the barriers I've identified so far. Those who have made it through and are still pursuing, and they're at that level where they're almost, consultants in the field that they want, it's essentially they've had the right support. They were at the right place at the right time, had the right mentors, had the right non-Pacific champions, and they were supported all the way through.
Yeah. And considering being a doctor as a career, it's such an intense line of work, and then being a mother at the same time, having kids. I don't know how someone could do that. You're doing it right now. And
no, actually, I'm just kidding. There's a reason why I don't have children. I love my sleep too much. So that's one of the things. But I did a systematic review just on some studies about if you're a medical student, even earlier on at medical school, if women identified at medical school that, this career or line of specialty is not going to be conducive to me starting a family, I'm going to find something that is. And mainly the GP lifestyle, like what I've switched to, is more like amenable to you having a better sort of lifestyle and work balance. So those other specialties like pediatrics.
Right.
Sorry, I lost track of your question.
No, that's okay. Yeah. So it's like about, figuring out what you're doing in your personal life and finding a right path for it.
Yeah.
But what you're saying is that because there's these barriers, we need to adjust different parts of the system so that it can fit women who may be in different situations.
Absolutely. Absolutely.
And how important do you think that is in your work? I know it's very important. You're writing a whole PhD thesis about it, but how do you see itself in the future?
I think it's evolving, mainly because the health system has no choice but to adapt, because for the last 20 years, more than 50% of medical school enrollments have been female. Same thing for Pacific. There are more female medical students than male medical students. So by 2025, there'll be more female doctors than male doctors. And if we see a pattern, which is why I'm doing this for Pasifika, we're going to see a pattern where more and more are going towards, careers that are very good for their lifestyle and for child rearing. And then we have understaffed specialties now, for example, surgery, and the ones that require a bit more sort of time intensive and takes longer. So then you will have a disproportionate sort of distribution of the Pacific health workforce. So the health system will have no choice but to try and then sort of entice or get more people to come to these understaffed specialties. So I think it's going to improve. Definitely within the next, hopefully, 20 years. Again, what I'm finding is it's a culture change. I did that systematic review. Unfortunately, nothing has changed much for factors influencing career choices in female medical students in 10 years. But I have a feeling with all the movements that are going on right now and the proportions of women coming out, it will change in the next 10 to 20 years.
That's awesome. That's really awesome. Now, one of the, large influencing factors to the health system, New Zealand health system, is government, politics, whether we like it or not. It influences everything. What could be, one second. Sorry. How crucial is it to have a government that prioritizes healthcare? I'm seeing a lot on TV now. There's the talking topics are just very race driven, or there's, things about housing, but how important is it for a government to prioritize healthcare?
Absolutely. I think any government anywhere in the world does prioritize healthcare to varying extents. New Zealand is no exception. In comparison to other governments, I think New Zealand does a good job of so far investing in their healthcare. There are a lot of historical issues, that have contributed to why our healthcare is the way it is. And we always have to remember that our context is very unique. We have, we have Pasifika people.
Yes.
But we're not just one people. We are more than between 60 to 40 different unique heterogeneous groups. We have we have Tangata Whenua, we have the majority Pākehā group. So it's really, really hard for a one-size-fits-all. And so I think it's doing as best as it can, but the onus is also up to us, as part of these groups, to sort of let the government know what it is that we need for our healthcare. Like you say, health is not isolated by itself, which is why you need to invest heavily on it. Health is associated with education. It is associated with socioeconomic status.
Yes.
And so, your country is only as good as its healthcare. So I think it's really important.
Yeah.
Yeah.
And so you have emphasized that it is important to have catered health approaches to different demographics, your socioeconomic status. There's been a lot of talk right now in politics to remove all of that because one size fits all from politicians. What's kind of your reaction when you see that from I'm being cheeky again?
That's fine. It's a very strong reaction that I have, mainly because I did a master's in public health and I did Hauora studies, Pasifika studies, and I could absolutely disagree with a one-size-fits-all. It's the way that I've been trained. It's why I do my research, because there is no one-size-fits-all. If there was a one-size-fits-all, my research will not just be on Pasifika women, it would be on all women. But unfortunately, this world is about, there's a lot of inequity, and you can't solve inequity by dishing out the same thing to everyone. I was going to do this here. I thought I might show it in terms of why it doesn't fit. Have you seen, what is your understanding of equity and equality? Do you?
Equity, I saw, there was an image that explains it properly.
That's fine.
I'm going to bring it up. It was kind of like people of different heights and standing over a barrier where they're watching a soccer game. And then it's giving all different people different types of resources so that they're able to view the game. And they may not be the same. One might need more than the other, but as long as we have the same opportunity to see what's going on in the soccer game.
That's right. So that one is widely used. There's another one that my Hauora lecturer taught me, and I actually used it in my medical school interview. So this is really simple, and I'm a very simple person. No need to overcomplicate anything. So what I've always been taught by my mentors is don't overcomplicate anything. Even if it's really hard to learn in medicine, simplify it. Simplify it as much as you can. So if we're going to do a one-size-fits-all approach, it's the same thing as in terms of equity versus equality, like what you're talking about with the steps, so you can see the rugby game, right? So if we're thinking of Pasifika Health, this is how I see it. So this is Pasifika Health here. We're already, down there in terms of where our health outcomes are in comparison to, let's go with everyone who's non-Pasifika, and that includes European, Pākehā.
Yep.
And if you're thinking of a graph, like sort of a concept comparison of this, is Pasifika Health, we're just over there, below half glass, only like a quarter full, and at half full you've got non-Pasifika. So if we're thinking, okay, quality, and we pour the same amount in there. All right, let's put the same amount of funding into Pasifika, that much. And then we put the same amount of funding into here. One size fits all, why not? Where are we? We're still no better. We're still not catching up to everyone else who's doing really, really well. Whereas if you're thinking, okay, equity, how do we aspire or to get to that level? Well, that means we just have to pour a bit more. There. And that's how we get to the same level as non-Pasifika. So just a simplification of why I disagree with that.
Yeah. And that's a great example of how to really explain it. I'm just having a hard time trying to find why people don't understand it.
Well, I'm just wondering why. I'm just thinking this should be red wine.
Maybe it's, I don't know, politics is politics.
Yeah, absolutely.
And people will always say things to, like you said, it's the old school thinking. Times are changing.
Absolutely.
Sometimes people find it hard to commit or adjust to change. But I definitely agree with what you're saying. One size fits all health is not. Please stop using it as political talking points. We're all very different, but that's really awesome. So in regards to, achieving these better outcomes and more water, more resources being poured into our cups, what kind of change can we make on an individual level? And also, just to add on to that question, what kind of investment should we expect more from government or even the private sector?
Absolutely. So backtracking to in terms of what can we do as Pasifika on an individual level to sort of effect change, right? Did I hear correctly?
Yeah.
Simply for me, I was raised in a culture and in a household where you've got your problems, don't blame the world for your problems, try and fix them yourself. And then also you've got to be able to, like I said to my students, be the change that you want to see. I know it's very cliche, but it is also very, very true. Your successes and everything that you go through, you take your family along with you, you take your village and your church along with you. So, for example, if you want to be a doctor, what you have to do is put a lot of sacrifice in it. It's not an easy pathway. You've got to commit to it. You've got to invest in yourself. And I know that being told to invest in yourself is a very foreign concept for example, Pasifika or Samoan culture, where we're very focused.
We're told to invest in, give to others.
Give to others, yeah. We're told, which is fine, You're told to invest and give to others, invest in the community and the family. But then the thing is, what does that mean? For me, what I've learned is then learning how to redirect it back. Because if you invest in yourself, if you take the time to, make the most of your education, if you take the time to make the most of the scholarships available to you, and then stay on your pathway that you've committed to and look at the longer term goal, then eventually when you get there, for example, you become the doctor you want to be, or you take up a trade and then you decide, oh, I want to own my own building company, or you're in admin and you decide, I want to be a manager. Then getting to those positions, they're called leadership positions, and that's part of the Ola Manuia. So Ola Manuia is a document that came out by the Ministry of Health, and it's identified areas of need. One of those areas of need is leadership, and then you can put yourself in a position of leadership,
right,
where you can inspire others can see you, and then where you can effect the changes that you want. It's all about representation. So that's how you can do that.
It's a very common experience for Samoans, living in Samoa, when their parents are sick or when they start to pick up different health issues. It's common for them to want to bring them to either New Zealand or Australia for healthcare. I know a few of my cousins, even myself as well. My parents are just worried about the healthcare system in Samoa. What are your thoughts on the existing healthcare system in Samoa?
Absolutely. So it's one of those subjects where it's really hard to talk about, and also if you don't live and breathe the system like you do in Samoa, it's really, really hard for you to understand what it's like. I can speak because I lived the first 18 years of my life in Samoa.
Yes.
I lived throughout that system. I have many family members who are actually in the medical profession in Samoa. And in addition to that, I see many, many patients, like you mentioned, bringing their parents, from Samoa for me to see at the clinic that I'm working in. So from my own experience, it's really hard. Samoa and New Zealand are two very different health systems. They're two very different countries with differing levels of, economy and wealth. And I was only in Samoa last week, where we run a program. We go 3 times a year with 2 professors of surgery, and we have identified a need for the Samoa Medical School for us to go and teach a structured undergraduate curriculum, so a series of tutorials. And that was identified by the Samoan doctors. So we go through, we give these tutorials, and then I end up having talanoa sessions with the doctors there and also with the medical students. And what I've found just from looking and having these conversations is that it is a system under a lot of pressure. They are overworked, underpaid, underappreciated, just like any health system, in a developing country.
Yep.
Absolutely. And we have to understand that. And so those doctors there are fighting for more support, more funding, but it's really, really hard. The political system there is different to here. Whereas, there are not many groups that can lobby for this because there are repercussions. And so one of the things that's really, really important for me as a clinician here in New Zealand is when I do get my Pasifika patients or my Samoan patients from home, it's being able to provide that face of another Samoan face that they can be comfortable with. And a lot of that as well is just being able to speak the language as well, and then being able to understand what their health needs are. And then understanding that when you do send them back, that you can't send them back on medication that you have available here and they won't be able to access in Samoa. All right.
Oh my goodness, that happens so often.
It does. So you've got to think, is it something that they can afford and they can get through the system in Samoa? Or is it something they're going to have to go spend money on at private pharmacies? So that's where that knowledge of the health system comes in. Understanding that you may say, okay, go and see your regular GP. People back home don't really have regular GPs. People won't go see a GP unless they're in serious need of medical health care. In which case, if they do, their options are outpatients and then tertiary level care at the hospital. So those are things we really need to understand and be able to help our colleagues in Samoa. So there are various ways we can help, and I know of a lot of my New Zealand colleagues who go, with little groups and help run trauma scenarios. What we're doing from my side is we are focusing on education, and then while you're there, have a good conversation with the local teams about what they need. There's this thing where you go in and you barge in and you think you know what needs to be done. You may, but there's a culturally appropriate way to do that without stepping on toes and offending people. And majority of the time, my colleagues in Samoa have been amazing. For example, one of the things we identified was there's a real need to learn the skill of being a teacher so that you can teach your medical students, and then when they come through, they'll thrive, and you continue knowledge that way. And so we're going back in February to run a Teach the Teacher course, and that's going to be done with non-Pasifika. We're a very small group. There's not enough of us to do everything. So we take our colleagues who are experts and have the heart and want to help people. Yeah. So that's what we're doing in February. And then when we do that, we'll identify where else we can fit in. So I think that's how we can help. I know there's some organizations that have more organized approach to helping when the islands are in need. So that's how we can help.
That's, what do you call it? That's really interesting because your point that you mentioned, we're always wanting to go in and thinking we have all these solutions, but what really makes those solutions happen is having the respect, that cultural, and knowing the culture of how people work.
That's right.
In that space. So what would you say is a priority investment that needs to happen to improve
I'm very biased
because you've covered skills, you've covered tutorials, training, upskilling doctors, and also trying to pay our doctors properly and our healthcare workers.
Absolutely.
What is a priority investment that to improve someone's health?
I'm quite biased because I'm going to say public health and health promotion, but I do know that a lot of funding goes into it because it's what's hot and in right now with a lot of organizations. So I think that is being done really well because if you can prevent a lot of these modifiable conditions like obesity, diabetes, high blood pressure, high cholesterol, you can prevent all those and people have a better quality of life. But I do think right now, with how the hospital is, a lot of funding does need to be fueled into the inpatient services because I see a lot of my colleagues, they're going through a lot and they're stressed. If you could put more services in there, train up the registrars, give them, equitable pay, and then you'll feel really valued in your work.
That's amazing. You're so well spoken. I love the way you simplify things. I've met a lot of PhD students in my life. Gosh, you're one of my favorites.
Oh, that's good. Thank you.
And just on a leaving note, because I know this is tied deeply into your work, you did already mention it. Be the change you want to see. But what would be, let's say, someone leaving high school, they're facing a bit of problems at home, Samoan problems or whatever those problems may be. What would be your one encouraging word to that student who wants to become a doctor?
Absolutely. Look, Sometimes, making a change is one of the scariest things that you can do. I've spent time at university because my pathway wasn't straightforward. I left Samoa. I went to Dunedin because I wanted to avoid Samoans in Auckland. I was like, no, I want to be away from all of this. And I got really cold and homesick. I went to Dunedin and I wanted to do medicine, But I had a huge culture shock. Everything was so different. I couldn't really understand what the Palangis were talking about with their accent. and then I met a boy and my dad was like, that's it. You're not going to do well at school. And I didn't make it in on my first try into medicine. And I felt as if the world was going to end. Well, you got to realize the world's just started. The world's not going to end when you're 18 or 19 and you're going through a lot. And then sometimes you will have a lot of disagreements with your family, but realize that at the end of the day, whatever you choose to pursue, if you're happy, your family is happy. If you're successful, that's their success. I've repeated that before. And if you really enjoy what you're going to do, it's not going to feel like work at all.
Yes.
And that's what I love about what I'm doing. I don't feel as if I work a single day because I enjoy going in.
It's kind of like an obsession, and the hard part is getting to stop, right?
That's right. But that's the fun thing. There's always more to look forward to. And then I actually did a different degree. My pathway was I did an undergraduate in anatomy, and then it was like I took a 2-year gap year to try and figure things out. And then I went back and did a postgrad in public health. And then I was like, hey, why don't I just try for medicine again? And then went into medicine. I did the jug pouring thing like I did with you, and I impressed them. And then that's my journey so far. It's a prolonged journey, but the amount of lessons I learned along the way have been invaluable. So my advice is, you're going to have tough times. Get your family on board. If they're not on board, it's going to be a hard decision you're going to have to make if your family isn't particularly supportive.
Yes.
But try and get them to understand where you're coming from. I always say, always have a plan. Parents like it when you come and you go, well, this is my plan. This is my contingency plan. What do you think about it? This is what's expected of me. This is what is expected of you as my family to support me to succeed. And this is how much money I can bring you once I'm, so for your fa'alavelave
return of investment.
Exactly. So yeah, that's what I would say.
Oh, that's so awesome. Thank you so much, Dr. Melbourne, for coming onto our show. We appreciate your wealth of knowledge and wisdom sharing with us. We know this information costs and it takes a lot of time to gain. So we're so thankful that you're willing to come onto the show and make it accessible for a lot of our youth audience who probably a lot of them do want to become doctors, and I hope they are strongly encouraged by your message this morning. But thank you so much. This will not be the last time you're coming onto our show.
Oh, really? Okay.
Putting you on the spot.
Oh dear. All right, we're sorted.
But good morning, everyone. Have a great morning.